But to introduce our speaker today, we've got Joe Salemi from Galen Galen Healthcare, thank you. Who's one of the premier sponsors of New England HIMSS, and he's going to introduce our speaker today.
Thanks. All right, good afternoon. So David Maxwell is currently the program director at the ConnectME Authority. It's a state agency whose purpose in part is to facilitate the expansion of broadband services throughout Maine. His previous work assignments have included posts within the State of Maine Office of Information Technology and the Maine Department of Environmental Protection. So that said, he's welcome.
Thank you.
David.
Thanks very much. Okay, so it is a small crowd. I do have material here that I will hand out to you, or you can. I'll put some on each table.
Here, I'll hand it.
Okay, well, thanks, Brian. So yes, I am the program director at the ConnectME Authority. Now, I have been asked about the ConnectME Authority and what it is and where it fits in the organization of state government. The ConnectME Authority is a component unit of Maine state government, and as such, it is governed by a board. It's housed in a state organization, the Department of Administrative and Financial Services, but it is governed by a board, and Ralph Johnson happens to be a member of that board. He's a very active member of our 5-member ConnectME Authority board, which meets every other month or so. So does that tell you? Well, our office is in the Cross Building, the old state office building. You will remember that. Is that term, John? The Cross Office Building is a relatively new term, built along with the renovation. I have been with ConnectME for just about 2 years. My primary responsibility with the authority has been to administer the the capacity building program. So that's what I've been doing, and then over time I have acquired other duties as well. This tells you a little bit about the capacity building task force, funded by a 5-year grant from the NTIA. A requirement of the work plan was to develop a capacity building plan. The task force met 10 times during 2012 and 2013. We provided staff, and then an independent consulting firm called Planning Decisions Incorporated has worked alongside us. Here's the task force membership. Some of these names might look familiar to you. In fact, the second name down is my competitor in the afternoon. So Warren Cook, some of you may know that name from Sugarloaf. He was affiliated with Sugarloaf for a long time, and a number of other businesses and education and community development, business development. I think something that concerned me during my involvement in this is that we didn't really have any healthcare involvement in this mission. Now, not to take anything away from Deb and what he does with Health InfoNet, but it would have been. I think we would have benefited by having somebody from the medical community to be involved in it. Now, there are a couple of recommendations of the 8 recommendations the group developed that do pertain to healthcare, and you'll see them as we go through. But I would have appreciated some active medical community involvement. 8 recommendations from the task force. Here they are, helping business move to the internet. You can read them. The second and third, though, are the primary ones that I'll focus on for this afternoon. But helping the elderly stay at home, health data analytics, blended learning, an expanded laptop program. If any of you are aware of what Angus King did when he came in as governor to provide 7th and 8th graders with laptops. more governmental facilities, services online, Maine Turnpike, smart roads, and using existing funds to support more expansion of broadband, further expansion of broadband. I'm going to give you some statistics. We consulted with James Sewell Company to do a lot of mapping and data analysis for us. And what they did in 2011 is produce a baseline report giving us the lay of the land regarding broadband utilization, what businesses and individuals are using it for, how many of them are using it, and so forth. So that was the 2011 information. In 2013, they did an update to that, and these are the most recent statistics regarding that. So in Maine, we have, Maine being a large state geographically and very small interpersonally. If you spend any time here, you would experience that. We have 93.1% of all street locations in Maine having some form of broadband from at least one provider. Maine municipalities served on average by 4.7 providers. Of course, that's in the more populated areas. We have 43% of the geographical area of Maine having access to 4G mobile broadband. That is a tremendous increase over the 2011, and it's getting more and more prevalent. In fact, I just had some maps sent to me this morning that show it even greater. 89.8% of Maine households have broadband available, and 75% of households within that 89.8 are actually subscribing to broadband. And then again, more than 47% are using mobile devices, which is a dramatic increase since 2011. 93.7% of businesses in Maine have access to broadband. 93.1% subscribe. 46% are using mobile devices, but only 59% of businesses in Maine have a website. That was an interesting and kind of startling statistic to us, because we know the power of the internet, the value of it, and it just surprised us when we learned that only 59% have a website. So to address that, we have conducted a number of community forums around the state, and we'll be doing more later this year, to draw people in to learn more about the internet. And they've been very, very well attended. In some areas, it's interesting. We had one here in Bangor last week, and there were only 5 people in Bangor, but there were 36 people in Lincoln. Surprised me. I might have thought that it would be the other way around, but that was great. Yes?
When you say 59% of those businesses have a website, that's a whole separate URL, business or website.
Correct.
Right.
Doesn't mean that they're not mentioned somewhere in Manta, Yellow
Well, right.
Pages, and so
If you look
forth.
at Maine, demographics we have up here, and it's no small secret that there is a stunning amount of business done over Craigslist, whether it's buying, selling, bartering, services, etc.
That's right.
Some good, some not so good.
Yeah.
But that said, that's not part of that equation, right?
No, it is not. No, it's a branded, so to speak, presence on the web. It's John's cable TV show.
Separate URL.
That's right.
Hosted domain.
Yes, the domain.
You know, some of the dialogue though that we've had about big business in Maine, wood pellets. You need a website for some wood pellets. You know, you can kind of challenge, you need to still have a presence and an awareness about who you are and what your company is.
Right.
Or doesn't mean you've got a website just to sell.
Right.
You know, sometimes you see in Yelp, you'll see the company will be listed,
Yes.
and their address, their phone number, but you can't get any more information on that.
We we contracted with Nancy Marshall. I don't know if any of you know Nancy. That's right. So she has worked with us on the community forums to help people who want to develop a web page, help them start. Not the nuts and bolts setting it up, but things to take into consideration if you want to develop your own. It's interesting, in Lincoln last week, there were a couple of, no, it was actually down in Machias. There were probably 10 or so people in Machias, and we had 2 people who made Christmas wreaths and decorations, and a number of other cottage industries, so to speak, and they wanted to know what to do. So she takes the group through things to take into consideration in establishing your presence on the web, and using Facebook a lot too. So these identified barriers to broadband use are that people perceive that there is a lack of perceived value for consumers in owning a computer, and that has increased. And I guess that makes sense that it has increased, because as the universe the universe of people who don't have a computer gets smaller, then that number of people who don't have one and don't want one, I guess, will get bigger. Cost is down 3%. That may interest you, service providers, you ISPs. Cost is less of a barrier now than it was previously. Businesses, there's a lack of value, perception of a lack of value in having an internet connection. And again, cost is not as much of a factor as it was in 2011. So interesting. I guess I don't know what to take from that, but it's the data that we collected. A little bit about not knowing who the audience would be and what it would be comprised of. We have 7 tiers. The FCC has created 7 tiers of internet service, broadband service, and classified them at the following speeds. And so that's their classification. We do not consider the first generation to be actual broadband. Broadband begins in tier 1 with 768 up to 1.5 megs, all the way up to tier 7. How fast does broadband need to be? Again, basic applications on the left. Figuring that there would be people here in the healthcare industry, I highlighted here that doing remote diagnostics requires 6 to 10 megs for download, and again up to 2 megs for upload. Now, remote diagnostics can be that's a fairly broad term. Something that is in the works here in Maine, and we'll get into it as we're discussing the recommendations, is more in-home care and connecting with providers.
We talked this morning, David, before you got here, also about radiologists' insatiable demand for broadband.
Is that right?
Because they want their images and they want them now.
Of course.
Images are very intense in size.
So then here we are to do telemedicine, again, a broad term, 10 and 25, but if you get down here to apparently what you were talking about this morning, real-time imaging, you've got to have, you need the whole shebang, as much as there is. Now you, Ralph, have spoken in the past about how things have transformed in your hospital, in particular with ER doctors who are on call and working remotely, not necessarily in the hospital, but on call and available.
Consultants to the ER.
Not ER doctors, okay.
Yeah.
Consultants, okay, so yes, so they're using broadband for that purpose. So imaging, they want it all,
And they don't want to pay for it.
and they don't want to pay for it. Well,
Wait
okay.
for it. They
Oh,
don't
wait
wanna
for it, wait for it, okay. I'm sorry that this, slide is not as clear as possible. That was the best I could do in preparing it. So how Maine compares with the other states in New England, and this is for, this is 10 megs or greater. And the red is 2012 and the blue is 2013. So 10 megs or greater, and we are down at 11.7 and 6.7 compared to the rest of New England. This is a new map that that the Sewell company just created for us. And it shows the percent of addresses served by, this is a tier 5 map, so this is 10 megs. And the percent, so again, I'm sorry, it won't be evident in your packet either, but this will be on our website sometime next week. Percent of addresses served within a municipality, so you can see by the shading that it's in only concentrated areas where we have a high percentage of tier 5 available for use. But it is improving all the time, and you know that yourself.
Does Maine have pretty good coverage though? It looks kind of bare.
Well, this is tier 5, only tier 5, so yes, Maine has good coverage. We have 93% of the street addresses have something available. One of the things that the ConnectME Authority has struggled with, and the authority, including the board and the staff, we have struggled with the fact that we are to provide service to the unserved before we can really address the underserved. So, if you have somebody over here who wants service, we should really be taking care of that person who wants service as opposed to somebody over here who has service but really wants faster service. So that has been an increasing challenge. And how is that valued? How is that decision made on a value basis? If you're in a home with 2 parents and 3 kids, and one of the parents is doing the books for the family, and the other one's taking an online course, and one of the kids is doing homework, and 2 of the other kids want to watch Netflix, is that more important than this person here who may be able to stay in their home via telemedicine if they have service? It's a tough balance to strike. So what we have done recently, the board, has approved our thinking that from now on in the grant program that we operate, and I'll talk a little bit more about that, we are considering that anything under 1.5 megs is unserved. So that's how we have elected to address that.
Without redefining the definition of broadband.
That's right. Without redefining the definition of broadband, and that's right, giving specific definition to unserved and underserved. So no surprises here for any of you about Maine. We have an older and more rural population. 2010 statistics show that Maine spends more on Medicare than the national average. In 2009, we were the 5th most expensive state in per-person costs, and the growth in healthcare costs in that period, that 18-year period, was greater than it was across the rest of the nation on average. So what to do about that? Well, if you've been here previously, you know about the Meaningful Use Program. You talked about the Meaningful Use Program this morning, correct? And we have a state office for health information technology initiatives. That's a resource here in Maine. Health InfoNet, as you know, is going on next door. Muskie School is an organization that develops innovative approaches to health and social challenges. And then the healthcare claims database is something that's available for trending and research and other analysis. So what can we do here in Maine? We can certainly increase the use of telemedicine. We have, according to our report that we prepared, we have 71% of hospitals and 10% of local providers participating in telemedicine. Programs to allow the elderly to stay at home. Have you talked about that at all?
No, but was anybody at the Tuesday event at Paparazzi's? We had a really good speaker. I want to connect him with us, David.
Okay.
Dr. Canetta from Partners, and he spoke about the social media aspects and using it to engage the elderly in their health care.
Yes.
And he actually talked about the addictive nature of things like Facebook and even with the elderly, because they're starting to accept they Skype with their grandkids. Now they see a use for that
That's
computer.
right, that's right.
And, how can we turn it? So I'd like to get that presentation to
I'd love
you
to.
guys. So
Okay, yes, if you would, please.
we can talk about that, because it would really help us break some of these barriers.
There is an organization called Full Circle America. Are you aware of that?
A little bit.
Okay, all right. And it's based in Darmstadt. There's a doctor there, Dr. Chip Teal, who is working on this, keeping people at home. The cost of the service, well, the service is compared to $5,000 a month or so to stay in a nursing home. It's considerably less, but it doesn't rely on support services that are hard to quantify and qualify in terms of costs. But it's proving to be valuable. And then I'm interested in this recent information that Chip has that Ralph has shared. There was a piece on Channel 6 News recently. Diane Atwood did a piece on helping people stay at home longer, and there are statistics showing that you can certainly cut the cost by having somebody check in with a healthcare provider weekly, weight, blood pressure, pulse, if weight's up, what have you been eating, so forth and so on. And then partner with providers for training and for home-based care. The DHHS Health Information Technology Office is pursuing grants with the federal government, with FCC primarily. There's a program called the Healthcare Connect Fund, and DHHS will be submitting applications for funding for Healthcare Connect to do some of these things in order to spread the capabilities of the services. Healthcare analytics is a big and growing business, and in Maine, we're predicting that we know that there's going to be a shortage because we know that there are going to be fewer nationally. So the task force suggested that we build broad-based data analytics competency in our elementary schools, and then do more at the university level. So we're working with the university system to try to build this capacity. It was an interesting statistic, a piece of information that came up in one of our task force meetings, which Allison Hanley, who's the president of the University of Maine at Augusta, shared, is that the computer science program at Orono graduates only 80 students on an annual basis, which I found startling. I would have expected it would be considerably higher. So we're going to see what we can do to beef that up a little bit. And of course, the university is having its own struggles, just as the healthcare industry is. So, Well, let's have more of an interactive discussion about how ConnectME and you folks can work together to increase the usage, the deployment and usage of broadband in Maine. What do you have for questions or ideas? Yes.
I actually got a question for Ralph, if I don't mind. We talked a little bit about some of the promise of telemedicine and what it can theoretically do. And we talked about some of the challenges that lack of broadband coverage in certain areas and certain populations cause. Is this something that you, as a healthcare entity, believe is really going to be transformative for your populations?
Yeah, great question. You know, I'm putting on my CIO hat. I think, well, actually two hats. So for folks that don't know it, I'm also the vice president of quality for the hospital.
Yeah.
And when we really think about quality and how are we going to make those next big strides in changing the delivery, the quality of the healthcare we deliver, it's going to happen when the patient is engaged. So,
And that's kind of the question that I have, just looking at personal experience with my own grandfather, having all of this stuff put at his disposal. It worked perfectly. He could do he could do blood pressure, blood glucose readings. Everything could be taken in the home and done, and he never did.
right.
And
Well, that's where the speaker that I want to connect you with, he starts to talk about how do you do some like social engineering
yeah,
around engaging somebody without even realizing that, you know, I've got a to-do list or an elderly person to remember to take their meds. But how can you do something interactive? I'm trying to think of some good examples he gave. But, you know, you think about, for some of us who use a Fitbit, and it's automatically posting maybe to Facebook, and now you got a competition going with your spouse about, you know, am I going to get in my 4,000 steps versus who's going to get there first today? But how do you bring that level to that generation and make it something that they respond to and not a task they have to do?
Right.
I can't speak as well to it, that's why I want to connect him, but
Sure.
that is exactly it. And I think the broadband and the internet is where we're going to be able to get that engagement.
There's an application out there that is of interest. It's not a single application, but in the universe of applications, internet applications, there's something there that is of interest to virtually everyone. I do believe that. So finding that and making it available to them as a means of introducing them to the internet, then if you build it, they'll come. That kind of thing, I think, is definitely transformative.
So one of the things we think about is like with your iPhone, if it could perhaps detect what your pulse rate is or even your blood pressure, just by virtue of wearing it or having it in your pocket. Now you got the 4G, and it's going up into the cloud, and then you get a message or a text on your phone that says, geez, we kind of see your blood pressure's a little high today if you're taking your meds.
Yeah.
That's a different way of reacting and responding, and it's a passive feedback of the data to an action of reminding you to do something.
Right.
You know, they also have the ones where, you know, you could actually take your blood pressure and upload it every day.
That's right.
And in the end, you know, the doctor talks about, I really don't care what those readings are. I want you to do it every day, especially if you're a hypertensive, so that you see the trends. I don't care what the score is, but as long as you've got consistency or you're showing improvement and that you're looking at that and giving yourself feedback.
So personal responsibility, an element of personal responsibility in that as well.
But how do you, I don't want to use the word manipulate, how do you
Well,
get into the psychology,
Incenting them.
incentivizing them to
It's
do
true.
that?
It's true. It really is.
I would just put, you know, you said that he didn't use the stuff that the doctor issued?
Yeah.
He said kind of just like, oh, cool, but I'm all set?
yeah.
Okay. So when he was transported away from the hospital or physician or wherever he saw, was there a home health agency that was involved at all in this process that you know of?
I don't recall.
Okay.
I know that he got I think his diagnosis with, like say, diabetes really led to this, so there must have been some intervention there.
Possibly, yeah. My grandmother has diabetes too. So her readings on a daily basis are self-tracked, and they don't report to any cloud or they don't report to anything right now. But let's say in a situation where he gets discharged from the hospital, it's going to be in the future where the hospital and the home health organizations are working in tandem to ensure that, I'm sorry, I don't know what I was saying, but ensure that the patient was doing their vitals or doing whatever care plan that they're assigned, and they can report into a cloud. Now, eventually, the question was, will the broadband really change that? I say yes, because then we actually have an internet presence in their house. If it's not the actual hard line broadband, then we'll eventually have 4G LTE of some carrier there, and they'll have devices that are connected to the web or however have you. And what will happen is the information will be tracked, and if it's not tracked, the home health visiting nurses or the organization that is required to take care of that patient in the transition will have a care manager on top of all their clients that they can get flagged on if somebody's not taking their vitals by a certain time. A call puts in place, or maybe a video conference puts in place, and then the patient is then managed.
Let me give you a great example of what I'd like to see happen. And I think it could happen. You don't even need the home health agency. So you've got a PCP, a primary care provider who's responsible, especially in an accountable care world, responsible for keeping you healthy. You've got a bathroom scale. Most people still check their weight every day. You've got a CHF patient, congestive heart failure patient. Weight is very important because if their weight starts climbing, it usually means they're collecting fluids. And so when you start to see that climb in a few days' time, what if that scale that everybody's used to stepping on every morning or every evening, just uploaded that. And then it's going into a flow sheet somewhere in the primary, nobody's even looking at it, it's just going into a flow sheet in the EMR. But then that trend starts to happen. It triggers an alert, and then the care nurse in their practice says, it's on their call list the next morning to call that person at home and say, have you been taking your diuretics? Have you been getting out and exercising? We're just checking on you to see how things are going. It sounds a little bit, I don't want to trip on Snowden and what happened with the NSA, and they're not doing us any favors to start looking at this, but people are going to worry about, my bathroom scale's talking to the internet. But I think it's the right thing to do health-wise.
They have those.
Yeah.
And this Diane Atwood segment profiles a 79-year-old woman who's staying in her home. She has congestive heart failure. She's staying in her own home because she is in contact daily, or at least weekly, with Androscoggin Home Care and Hospice.
Julie Shapley.
That's right, with Julie's organization. So there's the social service organization part of it, and so it's just.
Has anyone heard of the Internet of Things?
Pardon me?
Has anyone heard of the Internet of Things?
Yes.
Because what you're talking about is based off of the theory of the Internet of Things,
Yeah.
that everything is connected and everything streams real time.
That's right.
But you can't have that unless you have almost like a nationwide wireless.
Yeah, but I agree, but I've got wireless in my house now that probably is reaching into every corner.
Right.
Probably not radiating me.
Wireless isn't going to put him on the scale.
No, but no, you got to have the scale. But you're right.
That's going to change behavior when you start giving him points that accumulate up to maybe a $50 grocery card if he goes down to Hannaford, right?
You're right. What was the one? I can't remember now from Dr. Kaveder's. Kavadar, thank you. His talk is one of these apps, like for directions, but it pops up with like a coupon. It's a different, unrelated to the service that's offered. But people use that app because they're interested to see what unique coupon they're going to get, even though it has nothing to do with what they're doing. But it gets them to use the device.
In population health, there are certain thresholds of monetary incentives that cause an increase. When you hit past the 500, especially into the $600 range, people stop and take notice. You give someone $600 a year, you're going to have 92+% of people doing it.
I'll share personal opinion, a little bit of probably on the political side. When we talk about Androscoggin Home Health, the devices that do a lot of that work now that will upload through a hub, either blood pressure, pulse rate, other things. The device makers right now have exclusive contracts with the home health agencies. I want to do it without involving the home health agency in every case, because home health is overburdening in some situations to those patients that don't need the full suite of activity from home health. But I can't buy those at the hospital unless I go through who's got the franchise.
I can give you a contact with device makers and stuff if you want. From my old world, I was at Verizon Wireless before this.
Good. But that's been one of the challenges we've had personally. It's the ones I've talked to.
Well,
Say, but you gotta go through Interstock.
It's that first layer of, okay, well, how do I get these devices in there? This second challenge is, how do I get a portal for my organization and the patient to be able to track them?
Right.
And then like we talked about earlier, we have portals on portals on portals.
But maybe you don't need the portal, that, in my example.
Well, if it's streaming through your phone, or if your Fitbit-like thing, or your wristwatch, or whatever, is actually real-time streaming the various metrics that they need to monitor you on. Everything just changed. Now the question is, how can you get it to stream real-time? So I've had discussions lately about, ever hear of white spaces, the spectrum of white spaces?
Yes.
And so I was thinking around here, like WHOM, wherever their antenna is,
Right.
if you placed white space communications equipment, you could probably cover the rest of Maine
Yep.
and into Canada. And I think theoretically you can get 7 gigabits per second, but that's only theoretical and it probably doesn't exist yet. Does that make sense?
It absolutely makes sense. In fact, we have a pilot project that we're working on with white space in the Waldoboro area. And one of the grant requests that DHHS will be putting into the Healthcare Connect Fund is going to be to do another pilot project using white space. We have the most available white space of any state in the union, and we need to take advantage of that.
I wonder why I didn't know that.
It's all the analog television stations we have.
It is.
Yeah,
It's
that's
up over spectrum.
Right, that's right. So very interesting, we're very hopeful. It will leap tall buildings and stop locomotives and...
Well, it will go through buildings.
It will.
The signal goes through buildings
That's
like
right.
the other
That's right.
communications don't.
So we're very encouraged by it. There is some, that in the initial discussions that we've had, there's been some trepidation regarding the reliability of it. When you're talking about life and death and so forth, you gotta be sure of reliability, whether it's white space or hardwire or whatever. You gotta be sure. So we're very anxious to have these projects happen so that we can test it.
So probably start working on that idea of every time you step on your bathroom scale, it spits out a coupon, a random coupon, as long as it's not for food or restaurants.
There you are, there you are.
Golf vouchers.
There you go.
So very, very, very interesting. Now, we've got these 8 recommendations. So one of my concerns in coming up with this report was that here you got these 8 recommendations. They're kind of all-encompassing across society. What do you do to do something about them? So I'm pleased that I'm working with a couple of philanthropic organizations that have expressed interest in doing something around some of the recommendations. So I think it's going to be that kind of thing. Frankly, we've had gubernatorial candidates say, yes, we're going to increase broadband availability and so forth. But there's an awful lot to do. When you get into the political realm, there's much that people want, and I'm not sure where broadband falls on that long list of needs. But I'm very encouraged by these 2 organizations that have stepped forward and said we want to do something. We want to latch on to 1 or 2 of these recommendations and do something with them as a pilot, so that you, ConnectME, can gauge the success and determine how you might do things in the future. Very encouraged.
I know Time Warner knows this, but a lot of people don't realize it. The ConnectME Authority is probably one of the best kept secrets in the state as far as grant money for for utilizing it for broadband adoption. And it's not just the providers that take advantage of that.
Oh,
Frankly,
That's
which
right.
is,
That's right.
so we got one of the FCC awards for healthcare about 5 or 6 years ago, and we were not part of NETSI, if people know what NETSI is, and I think a lot of people are congratulating us for not being part of NETSI now. We got ours up and built with the help of Time Warner winning that bid, but I couldn't come up with the 15% matching funds that I needed. The ConnectME Authority saw this as a golden opportunity to get a broad swath of broadband infrastructure in the state that then could be built on later. They supported that project, and now we have 4 hospitals and 5 clinics all connected with high-speed 45 meg or better.
That's right. Isn't that fabulous?
You won that top 10 award, didn't you?
And, I'm sorry?
The top 10 technological
Yeah.
advanced hospital 2 years in a row?
Yes.
Yeah.
Yeah.
Post-wired? Yeah.
Most
Post-wired.
We've got,
that's an attest to ConnectME, right?
It is, absolutely.
Shucks. I actually wanted to talk a little bit about the grant program, because we are entering our 9th round of grants. And that's been very successful. We've had 8 rounds, obviously. We're starting our 9th. We've had 8 rounds. We've issued about $9 million in grants to providers, and it's generally a provider community collaboration. So we have issued $9 million to a number of providers, and I can't pull out of thin air the exact count, but what we have done is provide the availability of broadband to 36,000 people who otherwise wouldn't have it. So that $9 million has been, we think, a darn good investment, and we look forward to continued grants to do that. We are ramping up our definition of unserved, so that baseline right now is 1.5 meg. Another good thing about that too is that because we have done that for the first time, an applicant can take credit if they're going from a served area to an unserved area, and in the course of going to that unserved area, they are passing through portions of the served area where they don't have 1.5 meg yet. They can take credit for that in not only addressing the truly unserved people who have nothing, but they can upgrade as well, and use that to their advantage in the application process. So we're interested to see how these applications come forward in this new way of thinking. What else can I tell you? Ralph, what have I missed? What have I not covered that you think?
Pretty good.
Have I really? Okay, would you remember that in your evaluation sheets, please? Thank you. Is there anything more? We've got providers here. I know that there are 2 providers. You're a data center designer.
I'm with CDW.
Okay. How about the rest of you? What's your affiliation?
UMC.
EMC.
Project member.
Okay.
I'm a HIMSS member.
Pardon me?
I'm a HIMSS member.
You're a HIMSS member. Okay.
And I have a degree in informatics.
Oh,
I'm working towards an MBA. I'm also a student.
are you? Well, my goodness, you're one of the things that we talked about then. Okay. Do you have anything you want to add to that?
No, other than there's a pressing need for rural Maine as far as transportation and healthcare for our seniors. And it's been acknowledged pretty much statewide that it's a growing concern.
Yeah.
And I was very interested to see what you had to say.
Sure. Okay. Well, I hope it.
I was trying to figure out what your plans were going forward.
Our plans for, I'll get back to that. I don't want this fellow to feel shortchanged.
Oh, no, that's quite all right. Thanks. I'm with Baker Newman and Noyes, and we've worked more on the meaningful use side. And
Okay,
information
sure.
security.
Okay, all right, fine. Our plans for, well, I guess I talked about it a little bit in that we have this capacity building plan. Now what do you do As far as ConnectME is concerned, we have limited funds. We give out in grants about $800,000 to $1 million each year. That's the way it has been, but our pot is getting smaller. We rely on the Universal Services Fund, the portion of the telephone bill that is attributed to the Universal Services Fund, and that's our primary money that we use for the grant program. Now, the Universal Services Fund, as part of our collaboration with the James Sewell Company in Old Town, we're looking at the Universal Services Fund and ways that it might be utilized differently. The FCC has expressed an interest in opening it up to greater use than what is allowed currently. So we've asked the Sewell Company to look at what we might do. So we have some recommendations coming from that company, and in fact, one of Ralph's colleagues on the board has asked us to share that information and come up with the ConnectME staff approach for how we would use that at an upcoming meeting. In fact, I think he asked for it for the next meeting, which I think is going to be in July. Anyway, so we're doing the 8 recommendations, looking for ways that no one entity or one individual is going to latch on to this report and embrace all of those recommendations and run with them. So it's my job, I think, it's our job to market the plan, market the recommendations, and market is a very broad term, but market it and articulate the benefits of each and the potential pitfalls for not following through on it. And the full report, the full capacity building report is on our website. You can look at it. It's a 60-odd page. I'll bring up our website if you'd like to see it.
It's riveting reading. I have a copy of my desk.
Is it? Thank you, Ralph. In fact, I autographed mine, I think, for you. Pretty simple URL there. But I believe that it is our responsibility to take this. I did not want, and I'll personalize this by saying I, because I was responsible for making it happen. I was concerned that this capacity building plan, which was a requirement of this grant from the federal organization, there it's done, and now it's going to sit on a shelf with a host of other plans that have been done by innumerable task forces on a wide variety of subjects. So I've really pushed to market this thing, and I think we're making success with the philanthropic organizations that are taking interest in this. So that's what we're doing next. So we're going to keep on keeping on with our grant program, and then take what we know and what we think should be happening and continue to push. One of the pitfalls of this, though, is that our grant, which funded in part this capacity building project and mapping and data collection and so forth, ends at the end of this calendar year. So how do we keep the momentum going? We've got to, frankly, I'm hoping, because my job depends on it, that the transformation of the Universal Services Fund will allow us to take the next step, whatever that is, however we choose to implement it, and that the board chooses to implement, so that we can keep making progress. We want to be able to provide everybody with what they need. It's very interesting when we do an annual report. Most state organizations are required to submit an annual report. And ours, we submit it annually, and it's usually only in the longer session of the legislature. The legislature has two sessions in a session. So it's have 126, it's the second term of the 126 legislature. So last year, we submitted our annual report, and our director, Phil Lindley, was talking a little bit, just giving a little overview of the report to the Energy, Utilities, and Technology Committee. And one of the representatives said, I don't care what you do, but there's no way that you're going to get my 80-some-odd-year-old mother to use a computer. He said this right in the open room, and it's fine. And Phil said, well, actually, if your mother, if staying in her own home for an extended period of time, perhaps the rest of her life, I'm not quite sure how he said it, but the point is that if your mother wants to stay in her own home, and the only way that she can do it is to use a computer to check in with a healthcare provider or a social service organization or whatever, she might latch onto that idea. And that kind of, you could see, Phil said that you could see his disposition on the matter had broadened a little bit. So, you know, there's somebody else who has been enlightened and hopefully will help us make things happen.
I think we got to make the point that Dwight made earlier, over and over again too, which is the concept of the Internet of Things.
Yeah.
That it's
Yeah.
not necessarily that you've got to have a computer
Right. Well, it's
sometime
true.
in the future.
That's true. That's right. Yes, and I should modify my vocabulary. So yes.
It could literally be the Fitbit-like device on your
Of
wrist.
course, or the glasses, or whatever, yeah, something.
Well, the scary thing about Google Glasses is the other day, I saw that they're making a contact lens now.
Is that what?
They're making a contact lens.
Oh my Lord.
Oh, no, they just got the patent for the camera in the contact lens. So, you saw that, right?
Oh, yeah.
Yeah, and all of a sudden you kind of go, oh. And that changes everything, because now the contact lens could correct eyesight more than it does.
It's
I don't know where it's
overwhelming. Imagine how it's overwhelming. I mean, my mother, who's 84, uses a computer, uses a laptop at home, and does email and checks some things. But it's overwhelming. The capabilities are overwhelming and incomprehensible to her. So,
Well, when it comes down to connectivity, let me ask you a question. Obviously, the senior citizen base is on a very tight budget, right?
right.
That comes down to paying for it. Are you in your social services unit within the hospital preparing dialogue to help advise them about the reimbursability of those broadband connections when they're tied to course of care?
It's a great question. Where we're thinking about it and where I have input is as we move to more of an accountable care type organization, my soapbox. The healthcare business right now pays us to fix people, not we don't get paid to keep them healthy.
Right, the preventive.
The preventive, which is really, and so we're trying to shift our organization to do the right thing, but we've got to stay sustainable. At some point, it's just like other social services, it's going to become important to provide that for them, whether they pay for it or not. It may be that we're going to pay for that connection as part of their insurance policy, or something underlying.
To your point, I mean, the hospitals will then in turn become just emergency facilities if we're doing the right thing preventively.
Or my organization has multiple physician practices.
Yeah.
At some point, primary care physicians are what's going to drive our organization, not the emergency room and the beds. Those are going to be last resort.
Right.
And it will be taking advantage of that. There's a great article from a few years ago in the New Yorker, Atul Gawande. He writes a lot of healthcare stuff, but he picked up on this study that happened in Camden, New Jersey, where they actually focused in on what was happening in the healthcare Medicaid population and isolated a majority of the problems to one apartment building. And what they found was, there was people on, TANF and a lot of welfare subsidies, not taking care of themselves. And the way to get them to be healthy had nothing to do with healthcare. It was to help them get groceries so they would eat better, to help them get transportation.
Yeah.
And the healthcare industry, So I'm thinking of taking that same concept to the broadband concept.
Sure.
When you've got that, I love the term now, boy, I'm gonna incorporate a lot more, that Internet of Things.
So that, it's actually a term.
Yeah, but no, I know that, but I never put it in this context until
Right.
today. This dialogue has helped me think it that way, with a healthcare
Yeah,
connection.
yeah, yeah. It's that wheel.
It-
So the insurers or
Yeah.
whoever is gonna be responsible for that care.
It's big,
Well, that's, I was gonna
way beyond healthcare, but it's big.
Oh, yes.
Yeah.
to piggyback off what John asked you, you know, is the healthcare facility or organization system going to eventually be responsible and say, look, we'll pay the $40 a month because that's more cost effective to us than it is, you know,
Yeah, absolutely.
or does it turn to the insurance payers like Maine Community Health Options or somebody like that who says, we want a bigger customer base, and one way to also keep our insurance premiums down is through this long-term, preventative medicine.
Right.
So I guess my question also to you is, have you started to engage insurance companies like the new co-op in Maine or anybody that has a presence like that?
We haven't really, not at ConnectME, but we really should.
Actually, you'd be doing the hospitals a favor.
It really is like a full service circle, kind of, everybody's kind of,
We should, we really should.
and they would love the PR exposure of kind of figuring out how to make that work and reach more of their own marketing consumers.
Yeah, okay.
I wonder, I know Kevin Lewis, I know.
Okay, all right.
It's a great idea.
Yeah, that is, that's really good. I've had an awful time engaging the real estate community, for example, which surprises me because I suppose, but
But at the same time, what's their incentive? You have to ask that. I mean, they just want to sell a house.
Well, the houses of the future are gonna have almost every appliance connected to the Internet of Things. And it goes up, like I said, it's big. Cisco's been working pretty hard at making this happen. I know that, so.
people consider that broadband, there is a generation out there, and I think you're a part of that generation, Matt, I'm not necessarily, that has the expectation that broadband is going to be there just as water and sewer and electricity are. And we get phone calls from people who say, I've just signed for a new house and I didn't realize that there isn't any broadband there. How can you help me get broadband to my house that I just bought? And I didn't think ahead to ask if there is broadband.
When I left Maine Med to come to Franklin,
Right.
and my wife and I were looking at houses, it was her choice on what house we were going to buy. My job was to look at how many wires were in the back of the computer. If there were two, we weren't buying the house because it meant we weren't getting broadband.
There you are. But see, that's atypical of the consumer. So anyway, but the insurance industry is, yeah. I'm running out of time, aren't I?
It's a great dialogue, David.
Well, I hope. I hope you have all learned something. I hope you've taken something away from it, if only the TD white space.
Well, I'm glad it's being used.
Yeah.
You know.
Very encouraged by it.
I still wonder what would happen if you were to transmit that signal at the highest antenna you could. If it was beyond just, I know you're Connect Maine, but if it was beyond Maine, because that one station, that one antenna covers the whole state, right?
Yeah.
But it also covers part of Canada and
Well, we're getting.
I know it's not on the summit because they abandoned that tower years ago, but it's someplace high.
We're getting to that too, because we're just starting working on FirstNet, which is a project, a national project, a national public safety broadband system that we are administering for the Maine Emergency Management System. So we'll be working on that. We'll be able to leverage information and infrastructure and so forth that we have now with FirstNet. So it's a building block kind of approach. You're set.
On behalf of New England HIMSS, thank you very much.
Well, jeepers, thank you. Thank you, Ralph.
Good week's discussion.
Learned something new today, and if you're interested in learning more, a business card, there's swag there. It's not exciting swag, but it's colorful swag anyway. and help yourself, and if you have any questions, give me a call. If you want to sit down and talk sometime, please, please get in touch. Okay? Thanks.
Thank you.
Thank you.
And I appreciate your kind comments on the evaluation. So the insurance, yeah, we really should.
He's the president of the insurance exchange. They offer to products.
Indeed.
Yes.
Fantastic. Right, oh, yeah.
They were part of the.
Mile a minute, you know. See, we're going to be,
No, I, strictly with EMC. That's what I, she's over at EMHS now as well.
what would you like me to do now?
Have you seen Pam? 3 weeks.
I'm sorry. Oh, it came out great.
I'm
I'm
yes.
sorry.
Yeah.
It's a big draw.
Not former.
Yes.
Maybe.
Hilton. I didn't see him anyway. He was
See,
picked
you
up.
may not know this, because you're fairly new.
Any good with you?
Yeah, so. Years ago. It's Bell, and he loaded me up with somebody out of New York. Time Warner was trying to get into this home care space, and Time Warner didn't go very far. I think the business model hadn't been fleshed out, but I was happy to be part of that pilot.
No, I don't.
But then it was the devices, and that's actually where I got introduced to it.
Previous
It was like, oh, but you gotta go see it.
reporting to Matt. That's fine. Richard, myself, Scott, Stephanie all reported to Matt. About 8 months ago, I switched from EMHS to EMC, project management. I use it for that, so it's been great. Lots to learn. Less stressful, yes sir, it does. I'll admit that out loud.
There's obviously hubs and that's what ideal is the organization that does Wi-Fi hubs as well. And they're not within home health affiliation. Okay, that's good. They're looking for.
And I'm not knocking the home health.
Oh, absolutely not.
But there's a lot of times when that's gonna add a layer of cost.
I didn't think about that, like you mentioned, because.
Well, they want to charge you to send someone out.
Exactly.
As often as they can, right? So you.
Or whatever the reimbursement is.
And this, that's one of the reasons why this whole thing's going to take place, is reforming the Affordable Care Act, is so that, primary physicians and things like that, or like that doctor in Florida, I just read somewhere where he's just lucky you got to pay $21 million for Medicare. I saw that. I did. That's ridiculous.
Yeah.
And that's the thing, is like,
They're like the no part.
if these home health agencies are starting to do, hey, we'll send it, they just kind of twisted the table a little bit.
Part of what's misleading about that article is, and I can't remember the drug, there's a lot of the top reimbursement doctors were ophthalmologists. There's some like $1,000 drop medication that they have to buy and then pass it on to the patient. The patient can't get a prescription for it. But Medicare reimburses for it, so they're buying it. And then they're getting paid back for it. But you gotta market it up. Somebody's still making some money on it.
Well, they also have to do an extra markup because in foreign countries, they use generics that infringe on their patents. So they have to make their money by charging what they didn't charge. That's part of the reason everything's so expensive here.
But when you think about those, the doctor was getting 21 million. The other ones are oncologists too. Right. And those drugs, because we run an oncology clinic, it's our biggest pharmacy expense.
Is it really?
Yeah. Chemo cancer.
Oh, no, I'm calling, oh, yeah, sure. Oh, man.
Thank you very much.
Thank you.
Thank you.
Could I have your card, Matt? Do you have a card for me?
I have your card, yeah. I'll leave you mine over here.
Okay, thank you. Yes. I was hoping that you're going to keep those USF recommendations in mind and how all of this threads together. Definitely.
You have some interesting things going on.
We do have a lot of interesting things going on. Yeah, I think anyway.
Absolutely.
The scale that you step on that gives metrics back to the provider through whatever mechanism is needed.
I think the way I described it, that should be what the work was. And I don't hear a lot of people talking about it. Collect it passively, load it into the EMR. Nobody has to look at it every day. But then you set up the intelligence of the EMR to
Yes.
say, I'm seeing a trend that's not good. You know, put up the analytics into the program.
That's right.
That then puts it on the work
Yeah.
list.
Yeah.
Now, do they make the devices already? You say yes, but they're only in the home health care.
Yeah, I don't think so. And I don't think somebody's thought through the second and third step before I
Oh,
say,
yeah.
Right.
Score health. No, sorry. Just kidding.
They might very well. The phoenix has risen before.
I know, and
I have a background in population health, and population health is very, very tricky because there's a group that wants it to succeed, but there's a group that doesn't because they still have to pay for the equipment in the hospitals and stuff. And they have valid concerns, both sides are valid. And I guess the best analogy I heard in the last few years was Becky Ryder. They have to have, they have two canoes and there's one for each canoe. And they have to be able to do both. And it's like, how do you do this? And it's hard.
wait for it actually take. We went too far into the new canoe. Trying to get our population, our reimbursement